Hello, good morning. This is Jim Wilson, chaplain at RMC. I have some special guests with me, Dr. David Zinn, who is our Vice President for Medical Affairs at Regional Medical Center, and I have Ted Embry, who is our Crisis Response Leader. He is the leader of the Chihal Crisis Management Team. And so we have gathered today to talk about our response to the crisis that has been imposed by the coronavirus. And one of the first things we're going to do is violate protocol by removing our masks so that we can better see and you can better hear us. But most of us are wearing masks as a response to a threat we've not experienced before, and it's very disturbing. So as we think about that, it creates a lot of stress on everybody, and particularly on our medical staff who are trying to deal with patients every day with this virus. So Dr. Zinn, what particular areas of concern do you see for our staff as they try to respond to all of the stress imposed by the virus?
Well, all of us here in the hospital have had experience taking care of patients with various viruses. But as you will recall, approximately 4 months ago, this coronavirus was designated a novel disease, meaning new and one that we hadn't been experienced in before. It started in China, and we all are aware of the outcome over there. Does it translate to us here? Yes and no. We are experiencing seeing patients with absolutely no symptoms, and then again we see patients who need intensive care and ventilation, and they do not survive. All clinical persons, doctors and nurses, have taken care of patients who have serious disease and may not survive. So the stress isn't there, but I think the stress is that we don't know who has it and how is it spreading. We don't have diagnostic tests available in the numbers that we need them here in the United States. We don't have a given treatment that is known to work in this disease. So we have stresses in all areas that do add to our experience. Right now, we have here at Regional Medical Center designated a COVID disease floor or area, and all the patients with that disease or suspected they are put on that floor in an effort to isolate and allow us to treat them as a group rather than having them spread throughout the hospital. So we are faced with various problems recognizing, diagnosing, and treating.
So Dr. Zinn, we know that this is unusual, it's different, it's novel. And so Ted Embry, as our staff goes through something they haven't experienced before, even though they're all very experienced, what are 3 areas or concepts that are involved in their trying to respond to this?
Well, with the coronavirus, it has changed the playing field in this sense that typically emergency room triage was the front line. But now, with coronavirus, it's impacted the entire hospital at a higher level. And with the ability to respond, those in the medical field have developed what we call in crisis response resistance, resiliency, and recovery. Resistancy is simply the ability to encounter high doses of stress and maintain a professional response to the patient regardless of the circumstances around you. And that's the resistance. A medical term of that would be it's similar to immunity to stress. And then with a situation with coronavirus that's extended now weeks, and we would anticipate even months, we are relying on our resiliency, and the staff are having to draw on those skills of having to pace themselves and learn how to continue to come in and work over extenuating times, schedules in a high impact level. Recovery is the third concept that I would mention, and that is to say that with recovery, there's a situation that a person is able to encounter when they have an overload. They're able to bounce back, recover, rebound, that ability to, maybe they've had a bad day, but then they can recover and return back to their normal functioning level. So those are the things that would be important.
Well, thank you. So next time we'll talk about more coping skills that are required as we're trying to maintain those three strengths.
Mm-hmm. Okay.
One of the issues I would bring up at this point is that in terms of resistance, Anniston has not been exposed to the disease for very long, except through news reports. We have experienced by TV the China, New York, even Birmingham. But it's only been very recently that actually we are seeing positive patients who require hospitalizations here in Calhoun County, and we have a very small number of patients being taken care of right now. So we are just finally getting to the point of caring for the patients at the more critical levels.
Right.
So as the reality of that settles in, we will have a greater need for coping skills to continue to respond.
Absolutely.
And what are those coping skills
And so-
that need to be there?
When you're talking about coping skills, we're talking about healthy coping skills.
Right.
And the first thing that goes in a crisis, an extended crisis, is our healthy coping skills. The big three is diet, rest, exercise. Those are the things that we control ourselves that help us maintain strength and health and a resistance to illnesses ourselves.
So one of the ways you showed love this morning was to bring us donuts.
That's
So-
right, absolutely.
So that's
That is-
not really loving, although it feels good and tastes
That
good.
is classic in a crisis.
Yeah. So in
The-
terms of diet, what should we be experiencing?
What happens is caffeine goes up and sugar goes up, and those are two things that need to come back down. And we need water and regular diet, such as we have here. And so diet, rest, exercise are very critical for the staff, and to lower or be cautious about caffeine intake or even self-medication would be a concern. Alcohol, drug use would be a concern for us in terms of healthy coping skills. And that's the ability, when I mentioned recovery, the ability to bounce back and recover that healthy relationship that we have.
Mhm. So what about slowing down, trying to slow down?
Yeah. Dr. Zen and I were talking earlier about the impact this has had on our families and the changes that are taking place in our families. What it's important right now is to slow life down, avoid making major decisions if you can, and make those daily decisions that gives you a sense of power and control and doing the things that you can do so that you reestablish a normalcy in your life, setting a new schedule because the life schedule is disrupted. Here the schedules are disrupted. So reestablishing a normal routine and working with your peers, which is another discussion we can have another day, the importance of working with peers and working through those things.